Everyone, welcome to our channel, Nabafu Immigration Consulting, where you'll get all your Canadian immigration updates and information. So my name is Proscovia Nabafu, your licensed immigration consultant for Canada. And today I'm here to talk about the changes in the express entry system. It's a pool of candidates from all over the world who qualify to submit their profiles into the express entry system. So for you want to qualify to submit their profiles there, they have to, the occupations have to fall under, three classes. Number one, Canadian experience class, and then federal skilled trades, and then federal skilled worker. But the most common one for people outside Canada who are skilled is federal skilled worker. And how this express entry pool system works is that when you submit your profile into the pool, that is when you qualify under one of the three classes that I talked about, then your profile will be awarded points according to just what it is. So they will consider factors of age, work experience, language proficiency, so that is French and English. So the Ministry of Immigration would get into the pool and invite candidates with the highest point. So they'd have a cutoff point number, and then they would invite people from that number up and above to invite them to apply for permanent residency. So you score points on your profile using the comprehensive ranking system that express entry uses to award you points. And the points you get are called CRS points, and those are the ones they cut off, for you to be invited for express entry now, or to be invited to apply for permanent residence. So the express entry system is kind of very, very, very competitive because they consider age also, among other things. So the more the age, the lesser points that you get, especially if you're further from 30 or 29. Actually, you get highest points in age if you're between 21 and 29 years. Then afterwards, after 1 year, each year that passes after 29, you lose some points until you get to 0. So this did not favor people who are highly skilled and who take long to achieve that success. So Canada Immigration looked into this and introduced an occupation-specific category, whereby the occupations in demand, people with occupations in demand in the express entry pool can be invited to apply for permanent residency. So the points may not be that high, but of course they'll start also from the highest points in that category coming down. So, but they don't have to be so high like it was before. As long as you have an occupation in demand, it's worth the try getting into the pool. So these are the categories that were introduced. The first one is French proficiency. We all know that Canada has two official languages, French and English, but they're encouraging more French-speaking people to come into the country, especially if they are skilled. So if you can do a French exam, official exam, designated by the Canadian Immigration, and that is TCF or TEF, and get CLB 7 and above, then you stand a high chance of being invited to apply for permanent residency from the express entry pool. The second one is health occupations. So health occupations, if you're working in health occupations, you also stand a high chance of being invited. Then STEM occupations, science, technology, engineering, and mathematics. And also trade occupations, those are carpenters, plumbers, etc. Transport occupations, and then agriculture and agri-food occupations. So this time around, I'm going to break down the specific occupations. So those are just the umbrellas, but even within those umbrellas, there are specific occupations that will be considered. So I'm going to, of course, French proficiency is quite obvious. Secondly, I will talk about the healthcare occupations. So healthcare occupations, these are the occupations that have been listed The first one is audiologists and speech-language pathologists, chiropractors, dentists, dietitians and nutritionists, education counselors, general practitioners and family physicians, instructors instructions of persons with disabilities, kinesiologists and other professions in therapy and assessment, licensed practical nurses, massage therapists, and then we have medical laboratory assistants and technical occupations, medical laboratory technologists, medical radiation technologists, medical sonographers, nurse aides, order lines, and patient service associates, nurse practitioners, nursing coordinators and supervisors, occupation supervisors, occupation